Pharmacology is benefited by the prepared mind. You need to know what you are looking for. In a spiritual sense, a positive attitude may help you get through chemotherapy and surgery and radiation and what have you. But a positive mental attitude does not cure cancer, any more than a negative mental attitude causes cancer. Most discoveries even today are a combination of serendipity and of searching. The history is important because science is a discipline deeply immersed in history. In other words, every time you perform an experiment in science or in medicine, what you're actually doing is you're answering a question raised by someone in the past. Why did I write The Emperor of All Maladies? A 56-year-old woman with an abdominal sarcoma, having undergone 2 remissions and a relapse, asked me to describe what she was battling. By the time I had finished answering her, I realized that I had written 600 pages. Sidney Farber was a pathologist. He was called a doctor of the dead. He was a pathologist who sort of lived in the basement of the Children's Hospital in Boston, and he became very interested in childhood leukemia. And Farber began to inject this drug, aminopterin, into young kids, in order to see if he could get a remission. I had seen cancer at a more cellular level as a researcher. The first time I entered the cancer ward, my first instinct was to withdraw from what was going on, the complexity, the death. It was a very bleak time. Cell culture is a little like gardening. You sit and you look at cells, and then you see something and say, you know, that doesn't look right. We don't know why, but pancreatic cancer has a very interesting physiological link to depression. There seems to be a deep link, and we don't know what it is. If something is good, more is not necessarily better. Not always. There is a duality in recognizing what an incredible disease it is, in terms of its origin, that it emerges out of a normal cell. It's a reminder of what a wonderful thing a normal cell is. In a very cold, scientific sense, I think a cancer cell is a kind of biological marvel. There is an enormous amount of options that a physician can provide today, right down from curing patients, treating patients, or providing patients with psychic solace or pain relief. So, in fact, the gamut of medical intervention is enormous. I think the way we think about cancer, the way we treat cancer, has dramatically changed in the last century. There is an enormous amount of options that a physician can provide today, right down from curing patients, treating patients, or providing patients with psychic solace or pain relief. My memory of my household is of one immersed in books and music. I have a very intimate relationship with Bengali literature, particularly Tagore, and my interest besides reading then was music. Mary Lasker was an entrepreneur. She was a socialite. She was kind of a legendary networker. She became interested in saying, well, you know, if these diseases don't have political support, we'll never conquer them. And she made, really, cancer her special cause. A strong intuition is much more powerful than a will test. Normals teach us rules, outliers teach us laws. For every perfect medical experiment, there is a perfect human bias. The trick to my writing, it turned out, was doing so exclusively in bed. The minute I even dared to discipline myself and write at the desk, I produced mounds of nonsense. Yet, sitting in bed, I wrote easily, effortlessly, fluidly. I became the master of perfect indiscipline. I wanted to explore cancer not just biologically, but metaphorically. The idea that tuberculosis in the 19th century possessed the same kind of frightening and decaying quality was very interesting to me, and it seemed that one could explore the idea that every age defined its own illness. I could write a thesis on the physiology of vision, but I had no way to look through the fabric of confabulation spun by a man with severe lung disease who was prescribed home oxygen, but gave a false address out of embarrassment because he had no home. There's a phrase in Shakespeare, he refers to it as the hidden impestum, and this idea of a hidden swelling is seminal to cancer. But even in more contemporary writing it's called the Big C. Good physicians are rarely dispassionate. They agonize and self-doubt over patients. If you take 100 breast cancer samples, 100 types of cancer have 100 different hallmarks of mutated genes. You could be nihilistic and say, oh, God, we'll never be able to tackle this. But there are deep, systematic, organizational principles at work in all that diversity. I once set myself a deadline, half a chapter a week, 20 minutes a day. The thought froze me instantly, like literary Botox. I returned to my non-schedule, sleeping, writing 20 minutes, and then back to sleep. Breakfast in bed, with juice congealing on the sill, pages and pages began to pour out again. We know cancer is caused ultimately via a link between the environment and genes. There are genes inside cells that tell cells to grow, and the same genes tell cells to stop growing. When you deregulate these genes, you unleash cancer. Now, what disrupts these genes? Mutations. Most days, I go home and I feel rejuvenated. I feel ebullient. I am a scientist and I am a physician, so I write papers. I'm human, we all are, all doctors are, and grieving is a natural part of medicine. As a doctor, grieving is a natural part of medicine. If you deny that, again, you'd get into this trap of curing and victory. I think grief is very important. I believe the biggest breakthroughs on cancer could come from brilliant researchers based in India. What does it mean to be an oncologist? It means that you get to sit in at a moment of another person's life that is so hyperacute, and not just because they're medically ill. It's also a moment of hope and expectation and concern. Robert Sandler is a child who died when he was 3 years old, and he is a child who was the first child that we know of to be treated with chemotherapy. If there's a seminal discovery in oncology in the last 20 years, it's that idea that cancer genes are often mutated versions of normal genes. A breast cancer might turn out to have a close resemblance to a gastric cancer, and this kind of reorganization of cancer in terms of its internal genetic anatomy has really changed the way we treat and approach cancer in general. Writing anything as an expert is really poisonous to the writing process, because you lose the quality of discovery. I think the cardinal rule of learning to write is learning to read first. I learned to write by learning to read. When you immerse yourself in medicine, you realize that hope is not absolute. It's not that simple. I began wondering, can one really write a biography of an illness? But I found myself thinking of cancer as this character that has lived for 4,000 years, and I wanted to know what was its birth, what is its mind, its personality, its psyche. There's a rising cancer trend and, as I said, one of the major contributors is the overall aging of the population. We aren't dying of other things, so we're dying of cancer. Probably the most important reason we are seeing more cancers than before is because the population is aging overall. And cancer is an age-related disease. I think when we use stress, we are often using a kind of dummy word to try to fit many different things into one big category. I left Delhi in 1989 and remember very little of how life used to be then. Increasingly, in my recent visits to Delhi, I've started to realize that the city has become intellectually very lively. It makes me want to discover the city over and over again. Cancer has enormous diversity and behaves differently. It's highly mutable. The evolutionary principles are very complicated, and often its capacity to be constantly mystifying comes as a big challenge. Post-war US was the world's leader in science and technology. The investment in science research was staggering. What we do in the laboratory is we try to design drugs that will not just eradicate cancer cells but will eradicate their homes. There is a very moving and ancient connection between cancer and depression. Every era casts cancer in its own image. Cancer is not one disease but many diseases. Cancer is not just a dividing cell, it's a complex disease. It invades, it metastasizes, it evades the immune system. The idea that cancer genes are sitting inside each and every one of our chromosomes, just waiting to be corrupted or inactivated and thereby unleashing cancer, is, of course, one of the seminal ideas of oncology. One day, I had a patient who was going through chemotherapy who came to me and said, "I'm going to go on with what I'm doing, but I need you to tell me what it is that I'm fighting." It turns out that the very genes that turn on in cancer cells perform vital functions in normal cells. In other words, the very genes that allow our embryos to grow or our brains to grow, our bodies to grow, if you mutate them, if you distort them, then you unleash cancer. Visit our website for more quotes, quoting.com.